Okay, so you're talking a little bit about what to do,
Right.
and you mentioned a little bit about treatment. What's the hope here in terms of treatments for people?
Well, I think it's really important to know that depression of all kinds is very treatable, and that it's not a normal state for someone to be in for an extended period of time. However bad their life might be, it's something that needs to be treated, because also depression impairs one's ability to cope with stresses and to solve your problems. So it's really important to, once you get the evaluation, to try to figure out what kinds of treatments would be helpful.
What do you find is used most in situations like that? Is it psychotherapy, or is medication the better path to take?
Well, for short depressions, for depressions that have only lasted for a few weeks or maybe even a month or two, oftentimes talking about one's problems and waiting for time to pass may be sufficient. So a brief course of psychotherapy may be helpful. People who have chronic depression, which is what we particularly focus on studying, so they've had depression for many, many months and often very many years, usually medication treatment is going to be the best and most effective treatment approach. There's a lot of antidepressants that are available, many different classes of antidepressants, and generally one or another antidepressant will be helpful for a person to help them get better from depression. If they can't tolerate one, then finding another one that they can tolerate well.
That's interesting. So do you find that there are certain events in our day-to-day lives that may result in trends in depression? Like, you know, in one year you might see more cases of it as opposed to another year. Do you look at things like that?
Well, there's things that are called risk factors for depression, and especially for chronic depression. And the risk factors, many of those things would come from early life. So early losses, very stressful early life environment, poverty, social adversity, those kinds of things put people at risk for having a higher chance of depression. Also family history. So if there's a history of depression, bipolar disorder, alcoholism, other kinds of mental disorders in the parents or grandparents, siblings, aunts, uncles, and so on, there's probably a higher risk for depression. So those are conditions that would make someone basically at higher risk or more vulnerable to get a depression once difficult life situations come up. So we're facing here in the beginning of the 21st century pretty tough economic times, a lot of job loss, a lot of economic stresses, and all kinds of things that people face that may tip them over the edge to depression. And a lot of these problems are tough to solve. So someone who's been out of work for a long time and they're depressed already, then they look around, they're running low on money, they're in a tough situation, and so that can really make it very hard to come out of the depression on their own.
I'm glad you brought that up, because I was going to talk about that, just the economy in general, and if that triggers a lot of people who may not have been depressed in the past. Also, you talked about people that have a history of it, but what about people that do not have a history? Well,
I think that's going to be an interesting thing to study as it comes out. I think that as a doctor who practices psychiatry, I'm certainly seeing people in my office where that kind of stress seems stronger and more intense than it's been for the last, say, 20 or 30 years. Like 9/11 was a tough time for people, but everybody was pulling together, and it seemed that as a country we were going to get out of that, and we're going to band together. People feel kind of more on their own and isolated when they're in a state of depression, and even if it's resulting from social things like the bad economy, they tend to feel like they're on their own and are going to have a hard time making it without help. And I would add something, which is that a lot of social organizations are very helpful for people who are depressed. Religious organizations like churches, synagogues, and so on. There's self-help groups like the Mood Disorders Support Group. Clearly people have friends and family that they can reach out to. Social isolation is also a big factor in chronic depression, and people really need to find a way to break past that isolation, get connected with people who are sympathetic, and try to get back toward functioning again. Because social isolation really is kind of a part of the cycle that makes the depression even worse.
That's interesting. So in terms of treatment lengths, what can people look at?
Well, for a brief depression, if someone's been depressed for 2 or 3 months, they probably need medication treatment for perhaps a year or so. If they've been depressed for 2 or more years, or for 10 years or 20 years, as many of the people we treat in our depression evaluation service have been, we generally say at minimum of 2 years after you're better. And it's important to say that medication is not the only treatment for depression. Psychotherapy is also very helpful, and sometimes combined treatments as well. So sometimes someone will start on medication and then may move toward having more, they may have therapy in the beginning to help them solve some of their problems, but then once they're trying to come off of medication later on, sometimes therapy can help them make the transition to life off of medication again.
That's interesting. And can you give me a sense of how many people you treat at your clinic?
We do, the Depression Evaluation Service is a research clinic. It's part of Columbia University and the New York State Psychiatric Institute, and we do various studies of depression and studies in which treatment is provided. So we're running studies in which, probably 100 or more people in a year are treated in the research setting.
Wow.
But then we're part of also the Department of Psychiatry at Columbia, and it's a very large department that provides inpatient, outpatient, clinic, private treatment. And so there's many thousands of people who are treated through our system.
Okay, terrific. Well, thank you so much for joining us. Dr. David Hellerstein, Associate Professor of Clinical Psychiatry, Columbia University. Thank you very much for that great information.